Hi, I'm Chanelle, one of the journalists at Manx Radio. Welcome to the latest edition of Manx Radio Newscast.
My name is Kevin Oliphant-Smith.
Right, and you've created a petition you've launched a petition. Can you tell me about it?
Yes, so basically I launched a petition which I've published on a Facebook page. I've created a Facebook page as well called Save Our Health Services Isle of Man. And this was more just to, I think, start the conversation. I wanted to highlight the problems and issues because I feel like people generally are all talking about the same thing. I come across so many people on a day-to-day basis, including MHKs, who completely agree with me, but no one seems to be doing anything about it. So this was me saying, well, you know what? I'm going to make a start. I'm going to raise this subject publicly and get the ball rolling, really.
Right now, before we go into, the traction that the petition has gotten, you mentioned some of the problems and the issues that you've picked up over the years from people that you've spoken to. What are some of those problems and issues?
I mean, of course, the big one from I mean, there's two sides of this. There's the patient's side, and then, of course, staffing side. So as a patient, of course, it's the waiting lists are huge. I think going to A&E has become the normal now for people because they can't see a GP. So A&E is getting full of people who ordinarily years gone by would have gone and seen their GP. But then equally the care that people are getting in A&E is also a lot more substandard to the way it would have been years ago, and that's due to staffing levels too.
Right, so that's from the patient side. Do you have the side of maybe employees? I know you were a former Manx Care or Nobles employee, right?
Yeah, so I've got quite a long history with Nobles Hospital. So um, I'm actually the third generation of my family who worked at Nobles. So my mother worked at Nobles for 25 years, and my grandmother worked at Nobles for 60 years. Um, so I've always had a great relationship with staff at the hospital. And I've got a lot of friends that work there, and they talk to me on a regular basis about the issues that they feel um are going on at Nobles Hospital. And it's become a lot more obvious now um that not only can they not get the staff recruitment, but they're not able to retain the staff under Manx Care. And what they're having to do now is recruit nursing staff from other countries to come and work here. And there's two sides of that. In one way, we're very fortunate that people from other countries do want to come and work here and give us their skills. But you have to ask the question, why don't people locally want to work at Nobles Hospital? Why do they not want to be in that profession anymore?
Now, would you be able to answer that question, that why?
Yeah, I can. So of course they made changes to the contracts. I think a couple of years ago now. The pension structure, um, the staff morale at Nobles Hospital is very low. It's a very stressful place to work. It's not, you know, you go there and you speak to nurses and they're very, very stressed. And I think sometimes patients can get the wrong idea. They can think, oh, that particular nurse isn't very nice to me. But it's not that at all. It's just that those nurses are so hard worked and they really do give everything they've got. And sometimes, they don't get breaks. They're doing the work of three people in some cases. And the money isn't very good at all. So, would a nurse who has gone through a degree choose to work in a job that's highly stressful, long hours, not very good pay, or would they choose to find another career that they can get paid more money and have more work-life balance?
Right. Now, so these are all very interesting stuff that you're raising. Before you put it or took it to the petition phase, seeing that you have had a relationship with nobles, third generation from your family that worked at the hospital. Did you perhaps try to reach out to some of the seniors to echo some of your concerns?
Yeah, so that's an interesting story actually, because it was after Teresa Cope came on one of your shows, um, and she was talking about the problems at the hospital and things like that. And I commented on one of the Facebook posts on the Manx Radio page and basically said I don't agree with this at all. Um, and I was very surprised that Teresa Cope contacted me based on that comment on Facebook and offered to meet with me. She said, "Well, okay, come in and talk with me." And I thought, wow, okay, she's given me a chance to talk and listen to me. Maybe I've got this wrong. Um, so I prepared some notes and I went and met with her at the hospital. Um, but straight away I was kind of caught off guard because I was led to believe I was meeting with her on a more casual basis to have a chat. When I got there, there was Teresa Cope and another, I think it was the director of nursing that was with her, a gentleman, and it very much felt like an ambush. Um, I was asking Mrs. Cope questions. She couldn't answer them without asking her colleague the answers. She didn't seem to have a grasp on what was going on. Um, I raised some other concerns that I'd witnessed myself personally when I was working there. And Teresa Cope did say to me, "Did you ever officially put this in as a complaint?" And I told her, I said, "No, because it doesn't work. Your complaint system doesn't work. I'm not going to waste my time." So she urged me to do a complaint, which I did with her in her office. She took those details and promised to get back to me and never did. And the complaint never got looked into. I tried to contact her after that meeting because she did promise to meet with me again. And she ignored me. She ignored my emails. She ignored my letters. Um, so that was just a little insight that I could feel on that particular occasion as to what the staff have to suffer with being ignored um, within their complaints and things like that.
Now, that incident, did that kind of make you lose faith in her as the CEO?
Not straight away. I did try my best to, I thought to myself, she's the CEO, she's a busy lady, maybe she hasn't got my email. So I really did try to make as many excuses for her myself. Um, I contacted her secretary. They even confirmed to me that the emails were received. Um, so there's unfortunately no excuse at all. And as someone who previously did work there and raised a complaint as a ex-employee, to know that that matter wasn't looked into with due diligence, again, what does that say about the organization looking after its staff?
Right. And in your petition, I know you also calling for Teresa to hand in her resignation. Can you tell me a little bit about that and how's the reaction been or the following been to your petition?
So I'll be honest with you, I'm a little bit surprised at the reaction I have had because I expected a bit more of a backlash from people. Um, unfortunately, and I've tried my best to avoid this, but some people see it as an attack on our NHS, an attack on our health services, which isn't the case at all. I'm not saying anything bad about our health staff at all. It's the management, it's the policies, and this isn't just towards better patient care. This is towards the staff being looked after and supported within their role as well. And at the end of the day, Nobles Hospital, our health services on the Isle of Man, we all need that. It doesn't matter what job we do, how much money we have. We have one hospital here, well, one main hospital, excluding Ramsey Cottage. And no matter who you are, we have to go there in an emergency. So I'm not looking at this just from my point of view. I'm looking at this for all the residents of the Isle of Man, which we all deserve better than what we currently have. Now, also, the tax has been raised this year to 22%, apparently to cover healthcare, to fund the healthcare. So I would be more interested to know how that budget is being handled by Manx Care as well, because if us, the residents, are now having to part with more of our money to fund a health service that's being ran poorly, then what's happening to our money?
And from some of the people that you've interacted with that may have come across the petition, what's the feedback that you're sort of getting, or what's the feeling like on the ground?
A lot of people are kind of almost coming up and patting me on the back because there's an awful lot of people who agree with me, but are scared to speak out. Um, because unfortunately, we know on the Isle of Man how people are treated when they speak out. Um, that they're in fear of losing their position. Um, you know, not being able to get a job in the future, not being promoted, etc. Um, and so many people say to me on a daily basis that they can't believe I'm brave enough to speak out, and kind of I've been warned several times that I shouldn't actually, um, because I won't be able to get a job or whatever it might be. But I think if that's the way people think, nothing will ever change. So it just takes one person to make a start, and hopefully other people will recognize that this is something worthwhile fighting for, our health services, because the way things are going, we're going down a slippery road to privatization.
As you said earlier, Nobles is your only hospital, or your main, your main facility on the island for people to seek healthcare. How do you feel, when you see those headlines, those negative headlines, those long waiting lists, those articles about people, waiting, patients, and their stories of what they go through? Because, as you said, it is the only or the main place that people would go to for treatment.
I think it's very sad. I think it's very, very upsetting to hear that so many people on our island are struggling with medical conditions, which aren't being addressed because of the huge waiting lists. So you've got many patients that are on long waiting lists that are having to suffer and wait for treatment. And what you find is a lot of those patients will be recurrent patients going to A&E for help because they can't get the help from their GP, because the GP can only do so much. They can't see a consultant because the waiting lists are, in some cases, years. So these poor patients they've got no option. They just keep going to A&E every week, maybe getting pain relief or whatever it might be, and then they're shown the door again and told you've got to wait until you get an appointment from the consultant. And it's no wonder we have a huge rise in the Isle of Man of depression. Unfortunately, suicide is another big one here. I mean, if you tell someone you can't work, you can't earn money, go home and be in pain for sometimes years until a consultant can see you, what do they think is going to happen to that person?
Has anyone from Manx Care tried to reach out to you or speak to you since you launched the Facebook page or the petition?
No, no, and I wouldn't expect them to, because it's what we've come to learn with Manx Care. Um, there's lots of things they've done which are very much PR stunts. So, for example, MCALs. I was talking to someone actually within Manx Care recently who agreed with me that MCALs is just a complete PR stunt. It's you know, you can call them and you can give them a complaint, but nothing will happen with that complaint. It's the illusion that someone is taking your complaint seriously.
And in terms of your petition, how many signatures would you like to get? And what would you do? Or would you be handing over that petition and the results to maybe the DHSC or to the health minister? Or what are you planning to do with that petition, once you close it?
I mean, the petition is just one thing really. It's just another tool in the arsenal. Um, I've not really even promoted it much, to be honest. Um, I've been speaking with MHKs as well. So there is an email, which I did put on the Facebook page for people to read, which I sent to the Chief Minister and all MHKs. I think that was back in May. And it was very sad to see that only 4 MHKs responded to me on such an important topic. 4 MHKs responded. Um, you know, we elect those people to represent us. And if you look at even the last 12 months, we've had people going out, demonstrating in the street, um, on different matters which affect smaller groups of the community. This particular subject affects all of us. So I don't know why someone hasn't done something about it before, quite frankly.
Now, from your conversations with the MHKs, I understand, a lot of it may be sensitive information, but what's the feeling that you're getting from those conversations with them?
So the ones that have been speaking to me, I was very surprised to hear that they completely agree with me and they've agreed that the Manx Care contract needs looking at again. They don't feel like it's working. They think that Manx Care have had long enough now to prove their worth and to turn things around, or at least make some headway. And all we've seen from Manx Care is them asking for more money. Every year, more money, more money. Bringing in private companies. I mean, I met with some of those private surgeons and nurses that came over to help reduce the waiting lists. They were getting paid a huge amount of money compared to our own nurses. They were having their hotels paid for, their meals paid for, their taxis paid for. So is this really good use of our money, taxpayers' money? I'm starting to wonder, do we need to have this 2% tax increase, or is this, are we paying for Manx Care's mistakes?
What would you like to see being done?
I really think the Manx Care contract needs looking at again. I don't think the right people are in management at the moment. I think the people that are in charge of Manx Care don't have the experience to be able to run a health service. So I think, go back to basics. Find some people who've been working in Noble's Hospital on the ground floor, people who've rolled their sleeves up for years, nurses who know exactly what needs to be done. Put them in those positions, put them in the management positions. And we don't need so many managers. They've got so many managers for such a small hospital. It's ridiculous. And they're all getting paid a lot more. You could get like 4 nurses for the price of one of these managers. It's ridiculous.
I think from my side, I think I've got everything that I need. Is there anything that you'd like to add, that you'd like to raise? Anything that I perhaps didn't ask that you'd like to chat about?
I mean, I think just going back to your question about what I would like to see, I think they need to that they're looking at the wrong bits really. So they're focusing the funding on Noble's Hospital. I think they need to look at primary care as well. So I think there needs to be more funding into GP services. GP services should be able to offer more from their surgeries and then build it up from there, because that will reduce the need for people to attend A&E, for example. So let's not wait until people are at a critical stage where they need emergency care. Let's try and address the medical problems before they turn into emergencies. That's what I would say.
Manx Radio has offered an interview to Manx Care to address some of the concerns of Mr. Oliphant-Smith. Manx Care has, however, declined the opportunity for an interview and instead sent a statement. It reads, "Over the last 3 years, the board of Manx Care has sought to be as open and transparent as possible about the challenges we face, our successes, and the continuing issues that mean we are not yet able to deliver the best small island integrated health and social care system in the world, which is our committed aspiration. Manx Care CEO and Chair appeared before the Public Accounts Committee in June 2024 to give an account of Manx Care's position to date, the condition of the health and social care system we inherited, the challenges we faced, as well as our efforts and achievements. In addition, in February, the board met with the Council of Ministers to discuss the financial challenges across the Isle of Man, including those in health and social care. We are proud of our achievements and aware of the work that still needs to be done. We do not get everything right, but we do not have control over all aspects of our work, which is challenging for us. We have strong relationships with the Department of Health and Social Care and value their support and challenge to enable us to improve. We have a strong and robust leadership team. Our non-executives have deep experience in health, social care, business and the Isle of Man, as do our executive team who continue to go above and beyond in their roles every day.
Thank you for making it to the end of the Manx Radio newscast. You are obviously someone with exquisite taste. May I politely suggest you might want to subscribe to this and a wide range of Manx Radio podcasts at your favourite podcast provider so our best bits will magically appear on your smartphone. Thank you.